providers, and they welcomed that opportunity. They were able to collaborate, share resources, we were able to provide professional development, and they were all really a big part of this whole process. So over the next 2 years, we were able to provide a preschool experience for over 40 children in town through the School Readiness Fund. We developed lasting relationships not only with our school readiness programs, but also with the other providers in town who took part in the professional development opportunities, still came to meet, even though they weren't receiving any school readiness funds. They became part of the process. One of the best things that funding brought to Colchester, though, was our great and fearless leader, Shelley Flynn. Unfortunately, she couldn't be here today to deliver this story herself, but her leadership has been a huge piece in our success. So we were thrilled with the school readiness piece, but you have to say, we now know that things start way before the age of 3, and we really wanted to focus on things from birth and be able to follow those kids beyond that 4th year and transition them well into kindergarten and make sure that they're successful in those first couple of years. So in September of 2007, it seemed almost a miracle when the William Casper Graustein Memorial Fund contacted us and invited us to participate as a discovery community. So we were able to join up with about 50 other communities in the state of Connecticut to focus on what we could do from birth to age 8. About a month later, the Graustein Memorial Fund, in partnership with the State Department of Ed, offered a competitive grant process to develop a community-driven, results-based blueprint specifically for what we could do for kids ages birth to 8. So we got the application and we looked at it and we kind of took a deep breath because now we're moving from 3 and 4 and we're going for 8 years. So it was a big commitment for a small town. But through unanimous vote, the School Readiness Council said we absolutely want to expand our focus. We became a discovery community and we started a blueprint process. What next was kind of a whirlwind. We solicited support from all kinds of stakeholders in town. We have our superintendent of schools and first selectmen attending our meetings. Almost nearly every meeting they were there for. Also, we invited our health partners, UCFS, Baptist Hospital, as well as TVCCA to join us, and they were excited to be a part of the process. Local businesses joined, as well as civic groups, faith-based representatives, and our parents have really spearheaded the initiative and are a huge part of the committee and also hold a lot of the leadership positions for us. So when we meet, we have over 40 people at the table, which is huge for a town of 15,000 people total to get that many people to commit to over a year to meet monthly for 2 hours to develop this blueprint plan. So it was a huge commitment and people really rallied around that. 5 members of our community, including our first selectman superintendent of schools, notice I keep mentioning those 2 people, attended the full RBA training so that we could build our capacity. We gathered and scrutinized data that we could use that would give us insight into what our community was like, what is the well-being, and what are the issues for our young children and families. We looked at things like how many of our mothers were receiving adequate prenatal care. Did we realize that the number of children that qualified for free and reduced lunch in town had tripled over the past 5 years? How did 153 families without a vehicle access outside social services in Norwich when the only bus line in Colchester goes to Hartford? So we looked at all of these things and we received input from over 1,000 Colchester citizens through forums and through surveys to help us look where and see where our gaps were and prioritize our first steps. The results that this dedicated team have achieved are remarkable. We're done with our planning, and we're into our implementation phase now. We have a bookmobile that goes and targets different neighborhoods. We have an early Head Start program, which we did not have before, that supports parents of young children and their families our stakeholders. And of course, the love of our own children. But like all good stories, ours has a twist. What we found was that surprisingly, all we had to do was even talk about it at our table. Things would come up, we'd identify data, we'd find a gap, and somewhere else things would happen. We have a school-based ECF social worker now in-house, a consolidation of town departments to better serve community needs. We have a regional health director so that we can expand our capacity to do needs assessments, to provide programming. And all of these things kind of come because the conversation happens. And we see, oh, we remember talking about that. Oh, look, now it's over there. And so the ideas kind of grew. So in Colchester, we realized the power of partnership. And I also want to emphasize that we have really great